So today we are going to be discussing the lumbar spine muscular anatomy, and I'm Michelle, and this is my partner Jeff.
Hey.
So an overview of the lumbar spine muscular anatomy. These muscles provide support and stability to allow for the normal functions of everyday life, and Jeff is going to give us a demonstration of some of those movements of everyday life in the lumbar spine. So we have flexion, extension, rotation, and lateral flexion of the lumbar spine. So the lumbar spine is surrounded by many large and small muscles, and here are just some of the small muscles that we have in the lumbar spine. And these contribute to the overall proprioception and balance of the body. When the spine and when the body lacks the muscle structure and support, it can't support the normal physiological function, which is basically the amount of stress or the amount of weight that the spine has to hold up in everyday life. And this can result in injury.
Next, we're going to talk about the deep intrinsic muscles of the lumbar spine. So these muscles involve the erector spinae muscles, the multifidus muscles, and the rotator muscles. These deep intrinsic muscles play an important function in stabilizing the lumbar spine. And then next, I'm going to talk about the larger muscles. They're found more intermediate and more superficial. And these muscles play a vital role in mobilizing, supporting, and initiating movement within the body. So these movements could be anything from standing, walking, or running. So now that we learned the deep intrinsic muscles, we are going to talk about all the muscles in the lumbar spine. So starting off with the erector spinae muscles, there are 3 of them. So from lateral to medial, it goes iliocostalis, the longissimus, and the spinalis. So their actions are extension and lateral flexion of the lumbar spine, and also it produces ipsilateral rotation of the head. So those muscles originate at the necular ligament, the thoracic and lumbar vertebrae, and the medial and lateral sacral crest. And then the insertions are at the mastoid process and the cervical and thoracic vertebrae. The next muscles are the spinalis. They originate at the upper border of the spinous process. They insert at the lower body or the lower border of the spinous process, and then these muscles also extend and laterally flex the trunk and neck.
So for the erector spinae group, we have a fun little acronym to help you remember the lateral to medial. It's I love spines. So moving on to the intertransversary muscles, which can be seen right here. They originate on the upper border of the transverse process, and then they insert on the lower body of the transverse process. And their function is to laterally flex the trunk and the neck. Next, we have the psoas minor and the psoas major, which can be seen here. The psoas major in red, it originates on the transverse process of the lumbar vertebrae up here and inserts on the iliopsoas tendon right down here. And its function is to flex and laterally flex the vertebral column, the lumbar vertebral column. We also have the psoas minor right here in purple, and it originates on the body of the T12 and to the L1 vertebrae, and it inserts on the ilium and the superior pubic ramus. And its function is to also flex and laterally flex the lumbar vertebral column. In this picture, we also have our quadratus lumborum in green, and it originates on the iliac crest and inserts on the 12th rib and the L1 to L4 vertebrae. Its function is ipsilateral flexion, so same side flexion, of the lumbar vertebral column and extends the lumbar vertebral column. And next we have the multifidus, which is a little smaller but longer muscle over here, and it originates on the sacrum transverse process of C3 to L5 and it inserts on the spinous processes. And its function is to extend and laterally flex the trunk and neck to rotate to the contralateral side, or the opposite side.
Next, we have the rotators lumborum muscles. So they originate at the transverse process of the lumbar vertebrae. They insert at the spinous process of the lumbar vertebrae, and then their actions are extension of the lumbar spine and rotation of the lumbar spine too. And then the last muscle is the latissimus dorsi. So it's a flat muscle, and it originates at the vertebral spines from T7 to the sacrum, the posterior third of the iliac crest, just below the third and fourth rib, and it inserts at the floor of the intertubercular groove, and the action is to extend the arms and rotates the arm medially, but it also supports the back too as well. So now that we're done the muscles, we're going to learn about the lumbar plexus. So this is a web of nerves that projects from the L1 to L4 nerve roots, and it supplies the skin and the muscles. The nerves also stemming from the lumbar plexus are crucial for the function and proprioception of the lower extremities, and it also helps to with the ability to extend the knee, flex the hip, and adduct the thigh, and a couple other small movements.
Okay, and lastly, we have the thoracolumbar fascia. So this fascia acts as a container made up of 3 different layers. And so the most anterior layer here in red is where the psoas major is. And then we have the medial layer, which is in green, where the quadratus lumborum is. And finally, we have the posterior layer, which is in blue, and it encases the deep back muscles. The posterior layer is the most important layer of the thoracolumbar fascia to uphold and support the entire lumbar spine. So that is the end of our presentation, and thank you for watching.